I think if we think about pregnant women and women in general, we know that about 1 in every 3 women, regardless of pregnancy, will have some sort of musculoskeletal condition related to either pregnancy or pelvic floor issues. We have a 27-year-old, 29 weeks pregnant, second child. I've been treating her now 6 weeks. So she started getting lower back pain in her first pregnancy, and this is now her second pregnancy. She got lower back pain only in the 3rd trimester in the first pregnancy. Now she's had a little bit earlier. She's had some pelvic girdle pain, just on and off, but not really. It's been mostly lower back pain, but she's also caring for a toddler, so there's a few other risk factors involved. And she is hypermobile, but other things to consider would be...
So obviously perhaps not in her case, but other risk factors for pregnancy-related lower back pain can be previous like spinal conditions or spinal trauma, accidents, and then obviously it might be relatable to her, the amount of sleep that she's getting. So if she is caring for that other toddler, not sleeping enough, and that will then affect recovery. Carpal tunnel syndrome, which is sort of affects the hands, normally thumb and first 2 fingers, of weakness and tingling or numbness. And we know that's to do with sort of the increased water retention during pregnancy and the pressure that puts on the nerves. And then obviously that can be exacerbated after women give birth, because then they're caring for the babies, holding babies.
So it develops into this secondary condition. That's exactly what's causing this, what we call quervines through the top around your thumb.
Yeah, exactly. So that overuse, sort of tendon irritation in the thumb. And there are things we can do sort of quite quickly to help those, such as certain splints or support from taping.
A lot of pregnancy women care outside of some manual therapy, which they usually find some pain relief from, is activity modification. So just informing them what's going on and how they can move better to stop these conditions from coming about. If we go back to the case study with this 27-year-old, she notices her back a lot when she's having to try and dress her toddler, and her toddler's running from room to room, and then she gets down and then has to get back up, and then has to get down and then has to get back up. And I mean, how you manage a toddler is obviously a little bit more tricky, but at least you can identify exactly some of the aggravating factors.
And I think often positions during feeding, so using a feeding pillow rather than sort of having all the strain on your arms, and trying to avoid excessive bending when you're changing or bathing. So whether that's a high changing table or kneeling and changing on the bed rather than sort of being in those awkward positions, I think that can make quite a difference as well. I know a lot of ladies I've seen relate their low back pain to possibly the epidural that they might have had during labour, and that is something I've heard over and over again. And they've done a number of studies which actually has made no link to developing low back pain after pregnancy, and they think probably more likely is that during the epidural things are a little bit numb, you might not be in the best position for however many hours are left of the labour, and then also just having that new baby and having to bend and twist and lift and carry.
And that's exactly it. And I think having something that is a medical intervention is easy to put blame on. But if we look at the evidence as well, we know that the fitter a woman is going into her pregnancy, and the activity she maintains during her pregnancy has a big reflection on her developing pregnancy-related lower back pain and having postpartum lower back pain. So just like anything, the fitter you are, the stronger your muscles are, the more capable they are of handling change and load. Encouraging women to prepare their bodies pre-pregnancy, to continue being active during pregnancy, and then to structure their activity post-pregnancy not only decreases their chance of having this lower back pain, but also can decrease their chances of developing postpartum depression, which win-win.